All right, perfect. Good morning, everyone. Thank you for attending our session today. My name is Trish with Colorado Safety Association, and I also have Tanya Chapman is our safety and training consultant on, and I believe Job Vicario is our customer service and eLab learning coordinator on the line. We are happy to introduce and have John Olaechea from OSHA Region 8 on the call today. He's the compliance assistance specialist for Region 8, and he has agreed to come on and give us an OSHA update just about what's going on with OSHA and what's going on with Region 8. And I will turn it over to John and let him jump right in and get this presentation started.
All right, thanks, Trish. And excellent job on the last name pronunciation. I appreciate that. So everyone, my name is John Olaechea. I am what's known as the Compliance Assistant Specialist for Region 8 of OSHA. And in that role, what I do is just outreach. That's really the only thing that I am responsible for here in Region 8, and I'm really one of our only folks that does it, although we did just get a new compliance assistant specialist in the Sioux Falls, South Dakota office. So if anyone's listening in from the Dakotas, we're going to have a new compliance assistant specialist out there. But as I said, in this role, what I do is simply outreach. I did have many years in on the compliance side. I was a compliance officer for a while and did a few other roles. But I transitioned away from that about 7 years ago. So I always say, you know, the best thing that you can get from any of my presentations is just my contact information. I'm available to answer questions. You know, if you want information about a particular regulation, I can do a presentation on that, or I can just do a Q&A with your staff, or, you know, if you have an organization that would like to hear from us, happy to present or discuss anything that you would like. Again, I'm not really on the enforcement side. And, you know, even if you do contact me, you know, for those of you who may not be super familiar with OSHA, contacting OSHA is not how you get on an inspection list or on our radar. So feel free to contact myself or any of our offices at any time with questions, but please get my contact information if you can, or if you don't already have it, and feel free to reach out to me with any questions that you may have in the future. Also, I will send this presentation over to Trish, and she can send it along to you guys. If you PDF it, there will be links in here that you can use to get to some of the things that we're going to be talking about today. All right, with that, I'm going to actually turn off my video because it was glitching a little, and to save some bandwidth. And then we should be able to move to the next slide. Hopefully. There we go. Okay, so today we're going to talk about, you know, kind of what are OSHA's priorities at the moment, or in the coming, say, 6 months or so. And we'll be talking about our current emphasis programs. We have a few new ones, and we have an even newer one coming. And then a little bit about statistics, recent statistics from our inspections. We'll talk a lot about the heat emphasis program. I know summer is, you know, already halfway over, but this is something that we are really pushing this summer. And we'll also talk about a possible new standard on heat. And then along with that, the regulatory agenda, you know, what is OSHA looking at in terms of new regulations coming up? A few upcoming events here at towards the end of the summer, and then of course questions. If anybody has any questions as we go through this, please just, you know, take yourself off mute, blurt them out, or you can put them into the chat. And Trish and Tanya, I cannot see the chat right now, so if you do get a chat question, feel free to break in and let me know.
Awesome, we'll do that.
Okay. All right, I wanted to just let everyone know that we do have a new regional administrator in Region 8 of OSHA. This is our first permanent regional administrator in about 5 or 6 years. We've had a series of acting regional administrators. So towards the end of 2021, I would say maybe December or November, Dr. Jennifer Roos was named as our new regional administrator. She comes to us from the Navy and has tons of experience, quite a long and varied career in industrial hygiene, environmental health, has a doctorate. She's at CIH, so a lot of experience. And so she has been already with us for over 6 months, I think, at this point. And it's really nice to have kind of some permanent leadership in there. So we also just recently got a deputy regional administrator, Steve Biasi, who comes to us from a region back east. And so he's been in the role for about 6 weeks now. So we do have some new leadership up at the top. All right, I wanted to show you a little bit about inspection data and just kind of, I'm not really going to discuss COVID. Obviously, we had a healthcare standard for COVID. We have a national emphasis program for COVID, but just to kind of show you how it has affected OSHA in terms of what we've been able to do over the last few years. Just like any other business, we were affected by COVID, and you can see these are our total inspection numbers for each fiscal year up through 2020, and we were in the low to mid 30,000 range for total inspections, and then obviously fell off in 2020. We conducted a lot more kind of remote type work. So sometimes when we got a complaint, we would investigate that by phone. It's a non-formal or informal process that we have. And we already did some investigations that way, but we kind of tried to lean on that method when it was possible or when it was suitable. We still were going out on high priority items, but you can see that we did a lot fewer of those types of inspections in the fiscal year 2020. Now we're pretty much back to full force in terms of going out into the field. As transmission rates go up and down, when counties are high, we do still, as federal employees, have some requirements in terms of masking and things like that, but we are back to business as usual. All right, I wanted to share a few fatality stats with you. This is from fiscal year 2021. So our fiscal year actually ends in October, but we had quite an increase in fatalities last fiscal year. And we'll see what they look like from from fiscal year 2022 here in the next couple of months. But we had an increase. A lot of that was attributed to COVID because employers did have to report COVID-related fatalities if they were work-related to us. And I would say that that's probably even underestimated. So we did have quite an increase. But something that was unfortunate as well was we had a real spike here in Colorado in trench collapse fatalities. And then again in 2022, we already have had a couple, but in 2021, we had 4 trench collapse fatalities, and not including one other fatality in a trench where an excavator bucket kind of uncoupled and fell onto an employee that was in a trench.
Hey, John.
Yes.
Are those trench fatalities primarily small business related, or are they larger contractors as well?
So I don't recall on these in particular. I know a couple were small for sure. And I would say that generally that's what we see. We don't see the real big guys and the big projects so much as a lot of this is, just in my kind of anecdotal memory, I would say a lot of it is residential and small contractor. Going back to my inspection days, I responded to a number of these kinds of fatalities and accidents, and that's what we see. And that's who we're trying to reach. And I'll be talking a lot more here in a second about trenching, but it seems like that is where we see people unprotected for the most part, are kind of the smaller projects and smaller employers.
Great, thank you.
So here are excavation fatality numbers nationwide. And, we usually see probably low 20s in terms of nationwide trench fatalities each year. And I've actually heard some people say that seems kind of low. It really isn't that low when you think about all of these are completely preventable fatalities. And so we should be striving for zero, should not be as high as it is. And this year, we are well above that pace. So you can see the note at the bottom there. There was a press release that came out about a week ago at this point, and it was regarding the rise in trench fatalities that we've already seen for 2022. So we've already got through the first half of the year, 22 fatalities. And that's, just way too many. So we did put out a press release. If you get this presentation, you can click on that link if you haven't seen it already. And what it's going to talk about is the fact that we are, not prioritizing or reprioritizing, because we already were prioritizing trench, protecting workers in trenches and excavations through our emphasis program. But this memo came out and it said that we're going to even enhance those enforcement initiatives, and we're directing our compliance staff to conduct through the end of this year more than 1,000 more trench inspections. So we're going to be out there looking for it even more than usual. And I will say, we already do quite a few of them, because it's one of the things that people see. We get a lot of reports of fall hazards and trenching hazards because people see it and they call us. And it's amazing that it still continues when even the general public understand the hazards. And with that, I'm gonna, I guess that the slide that I thought was coming next is not coming next, but I will talk about the general public and their knowledge here in just a second. But I wanted to mention that for those of you in construction who may have workers who are potentially working in excavations or trenches, or if you are maybe a general contractor or in some trade where you know of others, we'd love to get the word out on this trench safety summit that we're going to be having here in Colorado on October 5th. And so it is in partnership with NACSA. They are planning to do a full day trench summit. So there's going to be some discussions about trenching in general. There's going to be some demos. We've done this in the past. We haven't done it the last couple of years because of the pandemic, but we did do this 2 or 3 years in a row back in the late 2000 teens. And typically we see about 400 people come out to this thing. It's a free event. It's all day. It's free lunch. Trench demonstrations. We're going to dig some trenches. We're going to have some OSHA inspectors and then some private industry folks that are going to be telling people about, not just trench safety, but how to set up, shoring, boxes, benching, sloping, all the kinds of ways that you would protect people from trenching hazards. And so it's going to be at the Adams County Fairgrounds. You can register at the website that I've provided there, or you can just click on the link from this presentation. So hope to see you out there. And even if you can't make it, please, if you're in the construction industry, pass this information along. And we will have, so there will be another OSHA newsletter coming out here pretty soon that'll have this information as well. All right, so I mentioned, trenching hazards should not be, they certainly aren't a secret. They should, it's really pretty common knowledge at this point, I think. And that's why, it's so alarming to see these high rates of fatalities already this year in 2022. And I just wanted to show an example of, where the general public even knows how bad these hazards are. I mean, we've seen it here in Colorado. There have been a number of news stories with trench fatalities each year. You see it on the news, and we get calls from the public when they see things that are hazardous, dangerous, kind of bad looking situations. And here's an example. This was actually an inspection that was conducted in North Dakota. And so the city, I won't name the city, but the city in North Dakota, their water department, I think they had a water main break or something like that. So they're doing a repair, and they wanted to inform the general public, hey, this is what we're doing. This is how the work is progressing. And so they started putting pictures up on their Facebook Live page for the city. And immediately, just, not construction workers, but just the general public were making comments all over the place about the fact that this looked awful. You can see this one has, not properly sloped walls, got water in the bottom of the trench, which is extremely dangerous because it's going to lessen the support of those walls. And so the public is saying, where's the cave-in protection? This was literally my first thought when seeing this picture. Did you see how they worked this summer? They're not going to start following the rules now. So, I mean, it's really, really difficult for us to see contractors still working like this when, pretty much everyone understands how dangerous these things are. And this ended up being what we call a media referral. So we went out and conducted an inspection based on the fact that within the media or social media, we found these issues. And so this ended up being a pretty sizable trenching case. Here's just some more examples of, people posting, hey, basically what's the deal? Why aren't these people protected? More comments here. So, it's just absolutely unacceptable that a construction company would be doing this kind of work and not understand the hazards. All right, I'm going to move on to what we're focusing on in terms of emphasis programs. And these really haven't changed a whole ton from last year, although we do have a couple of new ones. So with OSHA, we have a number of ways in which we would end up on a site to conduct an inspection. Our highest priorities are things like reports of fatalities or bad accidents, or complaints or referrals, or something like I just showed you before there, where we're getting information that there is a serious hazard out there, whether that's from the general public, an employee, a client, somebody just passing by, whoever it may be. If they report some really serious hazard, we're going to go out there, or if we hear about a fatality or a bad accident. But when we don't have those higher priority items, we fall back on these emphasis programs. And the emphasis programs are created to really direct our resources towards the best, most effective areas. And so we want to target those areas that have, high rates of injuries or illnesses, or maybe there's a particular hazard we're trying to address that we feel is not being properly addressed across one industry or one sector. And so we have these national emphasis programs. You can get a copy of any of these programs by clicking on the link on the bottom. So if you're in an industry that you think may be covered by one of these, you can download them, and you can see, how do you get on the list? Why are we conducting these inspections? What kinds of things are we going to be looking at during the inspection? It'll probably tell you a little bit about the inspection process itself. And so, for example, one of the longest ones that we've had for years is amputations in manufacturing. So we're looking at facilities where there might be machinery that could pull in a piece of clothing or an arm or rip off a finger or something like that. So presses and saws. And when you look at the emphasis programs, for the most part, they'll have a list of NAICS codes, which is the North American Industrial Classification System. Each industry has a 6-digit code that applies to them. Sometimes the fit isn't perfect, but generally we're going to determine that, you know, you have this NAICS code that you fall under, and then if you fall under that and that NAICS code is listed in the program, then you might get an inspection based on what that emphasis program is about. So with amputations in manufacturing, we're looking at, like I said, machinery, how well it's guarded, lockout, tag out, those kinds of things, training. Now, I would say the newest ones that we have are down at the bottom. COVID-19, we are still conducting those inspections. That is pretty much confined at this point to the healthcare sector and a few other sectors like meat packing industry, where we've seen some major outbreaks. And then we have respirable crystalline silica. That one has been around for a couple of years now. Due to the pandemic, we didn't really get a great start on that, but that is one where we're supposed to be doing about 2% of all of our inspections, looking at silica exposure, both in general industry and in construction. But that one's been around for a couple of years. The very newest one is outdoor and indoor heat related hazards. And we're going to talk a little bit more detail about that one. It came out at the beginning, well, I'd say not the beginning of the summer, but like late spring, we announced that one. And so we are conducting some inspections regarding heat. Here are our regional emphasis programs. So we have those ones that I showed you before are national programs. So they are being conducted by all the federal offices across the country. Regionally, we have regional emphasis programs that are being conducted in our 4 federal states. That would be Montana, North Dakota, South Dakota, and Colorado. Wyoming and Utah are, of course, invited to do these types of inspections, but they are what we call state plan states. So it is up to them if they want to pursue these. A couple of new ones that we have here in Region 8 that came out this spring are cut stone and stone products. We also call it the silica slab handling emphasis program. And so there we're looking at silica exposure specifically in the facilities that have the stone products or granite, where they're going to be fabricating this stuff. They're cutting it, they're shaping it, grinding, polishing, and getting it ready to be a countertop in a new construction, or even, you know, in an existing home that's being renovated, something like that. There are obviously a lot of exposures to silica in those kinds of facilities, and we typically have seen them not address those hazards adequately. And then in addition to that, every year we see slab handling fatalities. So you can see the picture on the side there. There's an employee who is kind of guiding a slab of stone while the other employee is moving it along on the forklift. And so there are kind of specific methods that should be employed both in moving that product and also in the storage of it. Some of the racks are in bad condition, and people who've gotten in between racks or just been standing by a rack that collapsed have gotten badly hurt or even killed. And so that's the other thing that we're looking at in that program. There's also a noise-induced hearing loss program that we just introduced in the spring as well. And so this is going to be manufacturing facilities. There's about 6 or 8 NAICS codes on that one. And again, if you go, I'm going to go back one slide. If you go to the link here, not only can you find these national emphasis programs, but you can find the regional and local emphasis programs as well. So you can go to that, and if you're in so that noise induced hearing loss, that is just a manufacturing only. So those codes are going to either start with 3.1, 3.2, or 3.3 as far as NAICS codes. The specific ones are listed in the program, and if you download the program, you can see, does this program cover me or not? Oh, before I move on, I should also say we are looking at potentially adding another regional emphasis program here in the next couple of weeks. I think it's about ready to go. It is going to be on powered industrial vehicles. So that's going to cover forklifts, of course, but other powered vehicles as well that are kind of maybe similar to forklifts. They're going to be material handling type of equipment. It will cover both the construction industry and general industry. So look for that one. I will, as soon as we get it, I'll put something in our newsletter and send it out to everyone who's on the newsletter list. But that is something that should be coming pretty soon, because we continue to see a lot of accidents, especially from forklifts. All right, I wanted to briefly talk about our national emphasis program for heat illness, because it is new and it is something that we are really going to be pushing this summer. So, why are we doing this? Well, as you can see here, heat's the leading cause of death among weather-related phenomenon, at least across the country. And the 3-year average for fatalities related to heat has doubled since the 1990s. And I would probably say that that's probably underreported. I think we probably don't hear about all the heat-related fatalities, or maybe they're not linked. And just, from my own experience, we've been dealing with this for quite a while here in our region and really across the country. We do not have a heat standard. There isn't one yet. There is one that is kind of in the pre-rule stage, so in the infancy of being developed. But currently we don't have one. So heat is governed, at least from an OSHA perspective, through our general duty clause, which simply says that all employers are required to have or to maintain a safe and healthy work environment free from recognized hazards. And so we do consider heat when it's, when the exposure to heat is high, we do call that a recognized hazard. And so we do expect employers, once it reaches certain levels, to do something about it. And I can tell you that, just from my own experience, I did a couple of heat related investigations from accidents. One was a fatality. It occurred with a landscaping company. The landscaping company had a brand new employee. It was his very first day on the job. And the pace of work was very fast. And there wasn't, and this particular employee had come from out of town, from somewhere north, and it was his first day on the job, and they really didn't allow for that employee to become acclimated to the heat or to the pace of the work. And unfortunately, on his first day, he died just before lunch. And that's the kind of thing that we are trying to prevent, moving forward. And that employee, unfortunately, as I said, was not acclimated, was not ready for the work, showed up in kind of inappropriate clothes for the job. The employer did not provide water to the employees or ensure that they had really a way to get water. The pace of the job was 4 lawns per hour. And, they didn't provide water to the employees, as they left the kind of the office in the morning. And really the schedule didn't allow for them to seek drinks or water if they ran out, because they just had to be on the next job. So that's the kind of thing that we're trying to prevent. And 18 of the last 19 summers have been the hottest on record. So it just seems to keep getting hotter. So we got heat stress. That's really how, the overall load on your body from heat, and that can come not just from the environmental heat, but the type of clothing you might be wearing. You see asbestos workers in Tyvek suits, and those things just retain everything, don't let any heat out. And then of course the containment itself can be very hot. And then the kind of work you're doing. Is it office work? Is it sitting? Is it shoveling wet sand? So that's a big part of it too. What the heat that your own body's generating. And then heat strain is your body's response to that stress, to that load. And again, becoming acclimated, it's different for everyone, but becoming acclimated is going to help with how your body reacts to that heat stress. And then from that can come heat illnesses. Can anybody maybe in the chat tell me, or just blurt it out, what are some potential heat illnesses that can result from heat stress?
A stroke.
Heat stroke, yeah, that's for sure a dangerous one. Anything else?
What about heat exhaustion?
Heat exhaustion, yep.
I mean, that's a thing, right? It kind of precedes
Yep.
stroke.
Yep, absolutely. It's on your way to heat stroke. Hopefully you stop at heat exhaustion, but yeah. So here's a list of some of the things, kind of not quite. It's not really a list from least harmful to the most, although it kind of is if you go up from heat rash to the top, but then there's a couple other things there at the bottom. But these are some of the symptoms, and it's really important for your employees, if they could be in a situation where maybe they're an outdoor worker or they're working in like an industrial laundry or something like that, that they understand the symptoms. They understand the types of illnesses that could be related to heat, and that the management understands it as well, so that when people see, whether it's a coworker or a manager, somebody having these issues, then you can take some action to prevent them or prevent it from getting any worse. Heat rash is kind of the lower level. My daughter's she actually suffers from this. She's somebody who doesn't deal with heat well at all, kind of wilts if it's over 80 degrees outside, and she will immediately start getting bumps on her skin, especially like in the skin folds, like on her arms where her elbow folds. And then you can move on to heat syncope is just kind of a fancy way of saying fainting, heat cramps. So, when you see these initial types of things, people getting dizzy, people having maybe cramps, that is the time to take some action. Unfortunately, when people when that internal body temperature, that core temperature gets too high, oftentimes it's too late to do something about it. We've seen it probably almost every summer with football players. There's been a few pro football players that have died of this. There's been high school kids who get to the hospital and their internal temperature is just too hot, and they end up dying. And then a few other things. There's rhabdomyolysis. That is, I think it's kind of a more rare thing, but I've heard about it a little bit more recently. A Denver Bronco actually, one of the free safeties a few years back, got that, and I think almost lost his lower leg from it. The muscle breaks down and it releases some toxins, and it can be kind of a systemic thing, or it can be more localized. Sometimes you hear it called compartment syndrome. And then it can also affect the kidneys as well. So who's going to be covered by this heat illness program that we have? We have listed 70 high-risk industries based on reports of fatalities and hospitalizations over the years. And so we have quite a few on there, but if you go to the list, you'll see some of the ones that, might make sense or be kind of obvious. So in general industry, you've got quite a few: bakeries, foundries, glass manufacturing, warehousing, waste collection. Not all of these are going to face heat stress issues depending on, the conditions. Warehousing, it might be a warehouse where there's air conditioning, or it might not be. But there's a whole bunch of them. You can click on that link. It'll take you to the program itself, and you can see all the different NAICS codes that are in there. And then in the box on the side, I have the construction industry NAICS codes. And so these are all the construction NAICS that would be affected by this program. So if your NAICS code starts with those 4 digits, now NAICS codes go out to 6 digits. So if you know your 6-digit code, if it starts with, say, the first one there, residential building construction, if it starts with 2361 and then it's like 52 after that, then you would still be on the list. So these are the industries that we're going to be looking at. And what are we going to do? Well, whenever the National Weather Service announces a heat warning or advisory for the local area, then we are going to conduct some of these programmed inspections. So we're already going to have a list of facilities or places to go. And then when we get a heat warning or advisory for the local area, we're going to go out, we're going to cross a couple of those off, we're going to send some people out, and we're going to look and see how is that facility dealing with heat. And then also we're going to conduct outreach like, kind of like we're doing here today. And inspections will be expanded on heat priority days. That's going to be any day where the heat index is over 80. The heat index is kind of a combination of the temperature and the humidity. And then, and you can also, we have an app on our website. I think I got a link to it here where you can download it and you can see what the heat index is. And then in addition to those things, we are going to be following up on any employee complaints. So like, let's say we get a complaint about heat stress, we're probably going to go out on it, not do a non-formal investigation. Also, while we are conducting other inspections, if we hear from our, from our normal employee interviews, if we hear that there are complaints about heat, then we're probably going to open up an inspection on heat on that. When we're looking at 300 logs, if we see heat related issues, we're going to also follow up on that. So we're really going to be prioritizing this. What are we going to be looking at? So as I said, there's no standard. There's no heat standard for OSHA. There are, other organizations out there that have a fair amount of information on what you could do as an employer, whether it's NIOSH or ACGIH. But these are some of the things that we'll be looking at, not to say that you have to have all of these things in place, but these are the kinds of things that we'll be looking at to determine, well, first off, we're going to determine, do you even have, exposures that could be dangerous, or elevated in terms of heat. So that's kind of the first thing. But then if we determine that, hey, yeah, employees could be exposed to high levels of heat stress, now we're going to look at what are you doing as an employer? What steps are you taking to keep them safe? And so it could involve any of these things. Again, not to say that you have to have all of these things, but it's kind of a holistic thing. It's going to be a case by case. What is the employer doing? Do they have written programs that address it? Are they monitoring the temperature outside, the exertion levels, along with that temperature of the employees. Do they provide cool water? I mean, you're required to, but is that accessible for the employees? What kind of break schedule do they have? You know, if it goes, you know, if it's in the spring and it's been in the 60s and 70s, and then it's 94. Are they out there shoveling wet sand with no breaks, or is the employer, you know, backing things off? Can they take their breaks in the shade, or are they taking their breaks in the hot sun? How acclimatized are they? Other engineering controls and things like, you know, do they have like the little wet rolls that they can put around their neck? Those kinds of things. What kind of training have they had to understand when they might be affected, or when a coworker might be affected? And then the buddy system, you know, there might be situations where it's extremely hot. Do you want to have somebody working alone in the heat doing something that's going to really expose them? Should they have somebody near them to kind of keep an eye on each other? There's tons of information on our website. NIOSH, others also have lots of information. There's fact sheets. As I said, there's a smartphone app that you can download. There was a stakeholder meeting back in May. If you missed it, you can still submit comments about essentially how you think OSHA is handling heat stress and how, you know, maybe we should be. Any comments you have regarding that, you can submit them still until August 1st of 2022. And then just tons more resources here. And then with the last bit of time we have, I'm going to talk about the regulatory agenda. You know, what is coming down the pike in terms of new standards or updated standards. And so we have a number of things in what we call the final rule stage. And there's kind of 3 rule stages. There's the pre-rule stage. The pre-rule stage is a period where we put out requests for information and we say, hey, look, we're going to be looking at creating a standard. We'd like to gather information. So if as a stakeholder you have information, maybe monitoring data or information about how you handle these types of hazards, those kinds of things, we try to collect that. And then we create a standard and put it out there as a proposed standard. That's the second stage, the proposed rule stage, where we've developed a standard based on some, you know, back and forth with stakeholders and our own research and things like that. We put this proposed standard out there, and then it's up for comment. And then we'll collect those comments, and then we'll relook at that proposed standard. And then eventually we go to the final rule stage where we issue a final standard. Not all of these actions end up being a final standard. Sometimes, I mean, in the past, we've taken years to develop a standard that just never gets to the final stage. So it is a long process. It's a negotiated rulemaking. It's, you know, there's stakeholders involved. And so it's kind of a back and forth kind of thing. So here's the stuff that is in the final rule stage. There's an update to the HAZCOM standard. Probably not going to be a big thing for employers. We're really just updating it with the global harmonized system, the GHS, because that continues to get updated. OSHA standards don't get updated that quickly because it is a long process. So you're probably not going to see a whole lot of big changes there, but that final rule should be coming out in December. We've had a number of whistleblower statutes that have come out in the final rule stage. I won't get into those, but those are different types of whistleblower provisions where somebody may come forward and say that, you know, report that there's been some sort of illegal activity along the lines of these 4 bullet points here. And then we had a emergency temporary standard in healthcare for COVID that was issued final, and it was in place just for 6 months, but it has now been withdrawn because it was just a 6-month standard. All right, now we also have proposed rules. So these are rules that are in the proposed rule stage, meaning we've either put out a proposed rule for comment or we're about to put out a proposed rule for comment. And so some pretty interesting ones here. Most of these are just updates to the current standard, but there are a few completely new ones like infectious disease and tree care. So I'm going to just hit a couple of these real quick. You can go to reginfo.gov to see any of these that are in the proposed rule stage. And even the pre-rule stage, we'll put out a notice for information, and you can look to see. It'll kind of give you, a lot of times it'll give you an outline of what OSHA is wanting to address in the standard. It's not an actual standard or a proposed standard, but it'll say, this is why we're creating this standard, and this is the kind of information that we want to gather. So the tree care standard, this is probably long overdue. There hasn't been an OSHA standard for tree care operations, and we kind of piece together bits from other standards to try and apply them to workers that are, trimming and cutting down trees, in people's yards. And unfortunately, there's been quite a few fatalities and bad accidents in this industry. And we'd like to have an actual standard for it. So there's a proposed rule expected in December of 2022. Here is, kind of one of the reasons that we're doing this standard. You can see this is for landscaping services, which are a lot of this NAICS code covers. Not all landscaping services do tree trimming and tree care, but tree care falls into this. And we mostly cite, as you can see here, the most cited standard is the general duty clause, because we don't really have a good, kind of vertical standard for this industry. So we're stuck using the general duty clause probably more than we would like to. And then here is a list of fatalities from our website. So I ran a report, and this is, I believe, through 10 years, and there's 665 fatalities listed. Now this is for the landscaping NAICS, so they're not all tree care fatalities, but you can see here, most of them are employee killed due to contact with power line. That's another issue in the tree care industry, not just the falls. So I think there's three main issues in terms of fatalities in the tree care industry. There's falls out of the trees. There's being struck by something, above where, a branch is cut and then strikes a worker below. And then there's contact with power lines. That's a pretty common one. There's 2 power line fatalities just on this, 9 entries here. There's a few falls. There's being struck by a falling branch. So this is something that we continue to see, and we're hoping to address with the new standard. We also have an infectious disease standard coming that is being worked on, looking at maybe spring of next year. And this would be, I believe it's going to be directed mostly at the healthcare industry, but we'll see what it shakes out to be. But, the pandemic showed us that we were not ready for infectious disease, some sort of pandemic. So this is going to be a general infectious disease standard that should be coming out next year. Lockout tagout. This is just an update to the lockout tagout standard. So we realize that the lockout tagout standard, as many OSHA standards are, is a bit old. Hasn't been updated as much as it should have been. There's a lot of new computer-based controls that are out there. And so we're looking to try to bring this kind of new technology into the standard. And so we did issue a request for information from stakeholders back in May of 2019. They've been looking at that. and look to issue a proposed rule in 2023. And again, the proposed rule is not a final rule. It'll come out, and then people will have an opportunity to review it and make comments. Silica, one of the things that was determined, I think, from the courts to be missing from the silica standard was a medical removal protection section. We are protecting employees that or protecting them from a certain exposure level to silica, and then if they're over a certain exposure level, then in most expanded health standards like lead or something like that, if you are over a certain exposure level, then there's a medical surveillance provision and a medical removal protection provision if they find through the medical surveillance, whatever type of exam, or in the case of lead, it's a blood lead level. If they find that you've been adversely affected, then they'll remove you from that task or that job that is creating the exposure. And so there isn't that in the silica standard. So they're looking at putting that in. I thought this one was interesting. So some of you already understand that there are state plan states and federal plan states. And Arizona is a state plan state. We've determined that they're maybe not doing as good a job as they should be. And so this proposed standard that actually came out in 2022 is looking at pulling the programs, their final approval, to make it where we may actually go back to having federal OSHA conduct the enforcement in the state. But we'll see where that goes. But that is something that can happen. There's going to be some changes to the injury and illness tracking. So 1904, we had some changes back 5-6 years ago that required electronic submission of OSHA 300 logs by certain employers in certain sectors with certain amounts of employees at a site. And so the numbers there are going to change, it looks like. So currently, if you have more than 20 or more employees working on a site, you may be required to submit those electronic records to OSHA. So those numbers are going to change a little bit. And we are going to go back to, for some employers, requiring them to submit not just the 300A summary form, but also the 300 form and the 301 form. That was the original intent of the standard for some employers. We removed it, and they're looking at putting that back in, along with making the information available to the public. And it actually currently is available to the public. If you haven't seen this website, you can go on and you can download like it's an Excel sheet, and you can see what the injury and illness rates are for any company that is required to electronically submit. We don't really have time to get into them, but pre-rule stage items. We got PSM, mechanical power presses, workplace violence and healthcare and social assistance, blood lead level for medical removal. That's an update. That there already is a blood lead level in the standard for medical removal, but they're looking at updating that, probably lowering that level. And then heat illness prevention. So these are all things where we're looking at possibly either creating a new standard with heat illness or updating these other standards. Also, the workplace violence and healthcare, that would be a brand new standard also. So I won't hit all these slides because we don't have the time, but there's some additional information on those pre-rule things. And these are pretty far out. This is not something that's going to be, a final rule in the next year or two. So it's a long process, but I mentioned heat illness before. We have the emphasis program. We don't have a standard, but we are looking at creating a standard. And I mentioned, some of the reasons why before, the same reasons we have an emphasis program, but there is a request for information out. I forget the acronym here. It's like Advanced Notice for Public Rulemaking. And they put that out there a while back, just requesting information on these kinds of things. So OSHA said, hey, we're going to create this standard. We want to know from stakeholders any information you have on this. So again, these are kinds of the things that we would be looking at during our inspections, but we want to know how are employers handling these kinds of things. Here is this is what you will find in that announcement of the public rulemaking. This comes from that announcement, and it shows, kind of the reasoning why OSHA is doing this. You can see the rise in annual injuries and annual fatalities due to heat. And then we have some very, very long-term actions. So these aren't even in the pre-rule stage, but we are looking at these things as potential actions over the long haul. Oh, and then a few outreach events that are coming up. I mentioned the Trench Summit. There's Suicide Prevention Awareness Month. We're trying to put more information about that on our website. Suicide, especially in construction, seems to be on the rise, and we would like to get into a little more of information dissemination on that. There's, obviously no standard or anything like that, but we just want to provide employers with information when we can. There's something called Safe and Sound Week coming up August 15th. We're encouraging employers to put on some sort of special safety event or safety activity for their environment or for their work environment. There's a whole lot of information on it, including different types of activities and things that you could do, some ideas that you could do within your company. If you go to the website there, you can see some of the different things that you could do as an employer. You can also register to be recognized by clicking on the map, and it's right on the main page. So you can, kind of get credit for doing this. Also, if you would like to have OSHA come out and be part of your Safe and Sound Week activity, we can certainly look into doing that. You just give me a call or, send me an email, and we can look into that as well. So we're really encouraging employers to take part in Safe and Sound Week. And the last thing is I do have a newsletter. If you are not currently on the newsletter list, send me an email and I will put you on the list. And so when we have new regulations or a new emphasis program, we usually send that out in the newsletter. And I think that is it. I don't know if there are any additional questions. Be happy to answer them, whether they're on these topics or not.
Thank you, John. I don't see any questions coming up in the chat, but I appreciate you coming on and doing the session for us today. And I think, as you mentioned, you'll send the slides and we will post those, and we'll put the recording for this, Tanya, probably on our YouTube channel. Is that right?
We can do that.
Okay. And then just to let everyone know, on Tuesday, August 16th, for Safe and Sound Week, CSA has a webinar on safety management systems. And so you can go to our website and see that seminar is available as well. So I think that's it. I'm going to stop our recording now, maybe, if I can figure out how to do that.
I do have a question.
Okay.
John mentioned forklift being an emphasis program or powered industrial vehicles.